On March 30th, 2017, the Senate came down to a 50-50 vote in which Vice President Mike Pence cast the tie-breaking vote to nullify Title X. Since the 70s, Title X has served as the only basis for federal funding for family planning services such as Planned Parenthood. Without such services, many people who rely on them will lose access to affordable health care across America.
The issues concerning Planned Parenthood include pro-life movements and public protests against tax dollars going into the funding of preventative care. Abortion has been considered a controversial subject in the United States, yet politicians have taken a public stance based on their personal views. In truth, there is no direct federal funding for Planned Parenthood. Therefore, the motion against Planned Parenthood is not to defund, but to block the access of preventative care, as well as the general health care for low-income families. Funding primarily comes from Medicaid, a government-funded insurance plan for the lower class, where Medicaid reimburses the doctors and medical services. Studies show that Planned Parenthood, in a span of 10 years, saves taxpayers approximately $130 million by preventing unintended pregnancies. Furthermore, due to the Hyde Amendment in the 1970s, Medicaid is legally not allowed to fund abortion services, meaning that tax money in no way contributes to the financial coverage of abortions. Instead, Planned Parenthood provides health services such as birth control, pap smears, STD tests, and breast and cervical cancer screenings. In detail, the organization has completed nearly 4.5 million STD tests and treatments, including HIV tests, and approximately 65,000 family practice services, including treatment of chronic disease and authorization for hospital care.
The defunding of Planned Parenthood will impact a massive group of people of all kinds. One is people with low income. Planned Parenthood helps with those with low income get access to free health screenings, breast exams, STD screenings, preventive care like birth control, and family planning services. Second is people of color. Planned Parenthood states that over a third of people who rely on Planned Parenthood identify as African American or Latino. Between the two ethnicities, about 29 million African Americans and Latinos are on Medicaid. In most cases, Planned Parenthood is the only healthcare provider that they will access. Third would be people living in rural areas. More than half of the Planned Parenthood facilities are located in a rural area. In these areas, Planned Parenthood is the community's only access to preventive health care. Many states find trouble with finding providers that accept Medicaid, and there is a small number of obstetricians gynecologists that accept Medicaid. Lastly is the LGBTQ community. Many members of the LGBTQ community have greater health issues than others. Planned Parenthood acts as a safe space for people of all kinds to come in and get the care they need without discrimination.
As of now, there are approximately 37 companies who directly fund Planned Parenthood. These well-known industries include Adobe, Bath & Body Works, Ben & Jerry's, Clorox, Converse, and Starbucks. Besides these 37 are 161 companies who indirectly support it by supporting third parties that fund Planned Parenthood. Examples of these supporters include Abercrombie & Fitch, Amazon, Banana Republic, Calvin Klein, Crayola, and much more.
There are different viewpoints for different people and organizations. An organization that is against Planned Parenthood would be the pro-life movement, since they are against abortion. There are also some members of Congress, mainly Republicans, that have tried to attempt to end federal funding of the organization in the 1980s, but failed to do so. Some viewpoints from other individuals would be that the organization is very helpful since it provides reproductive health care in the United States and more. It also provides education in order for people to become more aware. Overall, there is a very diverse opinion about this, showing how there are different viewpoints for different people.
There are many solutions that surround this Planned Parenthood debate. Despite Title X being overturned, Maryland was the first state to say they still support Planned Parenthood and will continue to fund its Planned Parenthoods and their services. More states should follow by their example. Another is that the government can continue to help support Planned Parenthood under the same premise that they had, which was federal funds were allocated to all their provided services, but never for abortion. How the government has a role. The government has the option to continue to fund one of the biggest sources for sexual and reproductive health. Without funding, it will displace hundreds of thousands of patients who rely on Planned Parenthood as one of their only sources for health care. Annually, the government contributes to most of Planned Parenthood's revenue because they give grants and reimbursements for the health services they provide.
Despite the negative viewpoints toward Planned Parenthood, we recommend that the government should continue to fund Planned Parenthood because it provides other healthcare services besides abortion, such as breast exams and other tests for sexually transmitted diseases. Planned Parenthood has provided more than 270,000 pap smear tests and more than 360,000 breast exams in a year detecting cancer. It has also provided 4.2 million tests and treatments for sexually transmitted infections, including more than 250,000 HIV tests. Numerous amounts of people rely on their health care services that they provide. 1 in 5 American women have relied on Planned Parenthood, and they are one of the nation's leading providers of high-quality, affordable health care for nearly 5 million women, men, and young people. And they are the nation's largest provider of sex education. Furthermore, many people are in favor of the government funding Planned Parenthood. More than 18 polls over the last 2 years show strong favorability for Planned Parenthood and strong opposition to the efforts of Congress to block patients from accessing health care services from Planned Parenthood.
Barriers. Extreme politicians in Congress led by Vice President-elect Mike Pence and Health and Human Services Secretary nominee Tom Price are threatening to introduce legislation to defund Planned Parenthood. Recently, Republicans in Congress are taking the first steps necessary to repeal the Affordable Care Act. This effort would enact cruel laws to block millions of patients who depend on Medicaid or other public health care programs from accessing care at Planned Parenthood health centers. By defunding Planned Parenthood, this really means blocking patients who depend on public health care programs like Medicaid and Title X from getting their care at Planned Parenthood health centers. Approximately 60% of Planned Parenthood patients rely on these programs to access care, and most of those patients use Medicaid. If politicians in Congress succeed in defunding Planned Parenthood and in shutting down Planned Parenthood health centers, they would cause a national health disaster. Millions of Planned Parenthood patients would lose access to the preventative care they have relied on, like cancer screening, birth control, STD testing and treatment, including HIV tests. Even 48% of Donald Trump supporters don't want to see Planned Parenthood defunded. Since the election, Planned Parenthood associates were flooded with new volunteers, and hundreds of thousands of individuals donated to Planned Parenthood to make sure access to healthcare is protected. Recommendation for action. With Donald Trump and politicians like Mike Pence and Tom Price in power, it could mean disaster for our healthcare. Do what is right and stand up for your healthcare and others. You could do so by 1. Donating to Planned Parenthood to help fight political attacks and strengthen advocacy for reproductive health and rights like access to sex education, safe legal abortions, and health care at Planned Parenthood health centers. You could do so at www.plannedparenthood.org under Donate, or by calling 1-800-798-7092. 2. Speak out against hate. Planned Parenthood's patients include many of the groups that the Trump-Pence ticket targets, such as immigrants, Muslims, African Americans, Mexicans, and the LGBTQ community. Planned Parenthood's patients are from all walks of life, and they all deserve access to healthcare in a safe and welcoming place. If you are scared to stand alone, We have other interest groups who will stand with you, like American Civil Liberties Union, Color of Change, Human Rights Campaign, United We Dream, and more. Volunteer for Planned Parenthood. Go to www.plannedparenthood.org to sign up to volunteer with Planned Parenthood or call your local health center. And lastly, if you ever need access to healthcare, feel free to make an appointment and visit a Planned Parenthood near you.